Minor disorders of newborn. Delay in passage of meconium. Delay in passage of urine. Regurgitation of milk. Transitional stools. Erythema toxicum. Mongolian spots. Vaginal discharge and bleeding. Breast engorgement. Neonatal jaundice. Cradle cap. Napi rash, and finally cold, cough and sneeze. These are the some of the minor disorders found in the newborn. Let me see one by one. Passage of meconium. 94% of the neonates pass meconium by 24 hours of age. Some babies might have passed urine or stool in the labor room immediately after delivery. In the preterm babies, due to the functional immaturity of the ball, delays in passing meconium. If meconium is not passed within 24 hours of age and has associated with the vomiting and abdominal distension, anorectal anomalies or intestinal obstruction has to be suspected. Anal patency is checked by passing nasogastric tube into the anal canal. Passage of urine is also called as voiding or micturition. 93% of the neonates void by 24 hours of age. 98% of the neonates pass urine by 48 hours of age. The rate of urine formation is 0.5 to 5 ml per kg per hour. The common causes of delay includes perinatal asphyxia, limited fluid intake due to the poor feeding, increased fluid losses due to the radiant warmers, and increased environmental temperature. If there is failure to pass urine within 48 hours, renal function test and abdominal sonography to assess for the presence and the size of the kidneys and to rule out any genitourinary malformation is must. Regurgitation of milk. Most of the neonates vomit small amount of curdled milk soon after the feed. Child is usually active and vomitus is never yellow or green colored and the baby looks healthy. Treatment is burping after feed and reassurance. Burping involves placing the baby on the shoulder and giving a small stroke from the top to the bottom to help the baby to escape the air which was swallowed. Transitional stools. Transition from the meconium sticky, thick green or the black stools passed in the first 2 to 3 days of life changes to yellow color stool of the breastfed infants, and it is physiological, normal. Starts on the 3rd or the 4th day of life, is yellowish green and maybe watery and contains sometimes mucus too. Frequency of the stools increase up to 10 to 15 per day and usually decrease by 10 days of life. It's different from the diarrhea as it causes no pathological weight loss or no dehydration or no foul smelling stools. Dehydration can be identified by the sunken fontanelles. Foul smelling means offensive odor or bad smell. Treatment is no treatment except parental reassurance. Erythema toxicum. The rash usually appears on the 2nd or the 3rd day of life. It is a scattering of erythematous macules, papules, and even vesicles. Here, scattering means it is a spread of macules, papules, and vesicles. Macules means it is a flat, discolored skin which is less than 1 centimeter wide and no changes in the thickness of the skin. For the papules, a small bit swelling is present on the skin. Vesicles is a sac-like with a clear fluid in it. occurs over the trunk, face, and the extremities, while the palms and the soles are spared, differentiated from the pyoderma in the vesicular stage. Pyoderma, pus in the skin. Microscopy reveals eosinophils in the erythema toxicum and cultures of vesicular fluid are sterile. Eosinophil indicates allergic reaction. So erythema toxicum is only due to the allergic reactions and not because of the infections. And the cultures of the vesicular fluid are sterile as it has no infection. Treatment. Rash disappears spontaneously in 1 to 3 days of life and reassurance is important. Mongolian spots. Pigmented lesions found at the birth in more than 50% of the black Native American or Asian infants and occasionally in the white ones. Most common areas are found lumbar sacral region, occasionally in the upper back, shoulder, arms, buttocks and legs. Lesions may be small or large, grayish blue or bluish black in color, irregularly shaped and always macular. Treatment. No treatment except reassurance. They tend to disappear within first year of life. Vegetal discharge and the bleeding in a female babies. White glary vaginal discharge on second or the third day of life and disappears by second week of life. In the term babies, it is about 3 to 7 days of life. The image shows a diaper of a female child. It's a form of a withdrawal bleeding due to the removal of a maternal estrogen influence. Treatment. No treatment is required. Parental reassurance as it is self-limiting within 4 to 5 days. Breast engorgement. Full-term babies of the both sexes may develop breast engorgement on the third or the fourth day of life. A white or the creamy white liquid may also ooze from the nipples, and this is called as a witch milk. It is attributed to the transplacentally acquired maternal hormones. Only because of the maternal hormones it has been engorged. Treatment. It is normally lasts less than a week, although at times it can last several weeks. No compression, no manipulation of the breast since they won't reduce the swelling but can cause infection. Neonatal jaundice. Yellow discoloration of the skin visible when serum bilirubin is more than 5 mg per deciliter. Physiological jaundice occurs in the first week of life due to the several physiological changes taking place after birth. Usually, it appears between 48 to 72 hours of age, maximum intensity on the 4th to 5th day in the term and the 7th day in the preterm neonates. Does not extend to the palms or the soles and does not need any treatment. Severe jaundice shows yellow palms and soles or has jaundice at the age of less than 24 hours or at age 14 days or more. To assess the jaundice, press on the skin over the forehead with your fingers. To blanch, remove your fingers and immediately look for the yellow discoloration under the natural light. Treatment. Frequent breastfeeding. Early morning sunlight for 15 to 20 minutes. Make sure cover the eyes. If the baby is a male, the scrotum has to be covered by a diaper. Cradle cap. Scaly yellow or the brown patches on the scalp. The scales flake off and the skin can look a bit red underneath. It doesn't cause any itching or discomfort. Treatment: avoid picking at the scales, rub a vegetable oil onto the scales, wash with baby shampoo. Brush the scalp using a soft baby brush at least twice daily. A vegetable oil can be applied to 30 minutes to 1 hour, not more than that. Avoid using the olive oil as it is very sticky. Napi rash. Result of exposure to the wet or the dirty nappies for a long period. Rubbing against the skin, soaps, alcohol-based wipes can cause nappy rash. May have red patches, feel hot to touch, pimples or blisters too may be formed. Treatment: wash with the plain water, dry front to back, change the wet linen as soon as wet. Don't use alcohol-based wipes or detergents. Don't use talcum powder. Lay on the towel and allow dry the skin in open as far as possible. Coughs, cold and earache. They usually get fewer cold to build the immunity when they grow older. They may have blocked nose or runny nose, cough, sneeze. Treatment: steam inhalation with mother providing warmth, saline nasal drops can help. So these are the minor disorders of the newborn. Delay in passage of meconium, delay in passage of urine, regurgitation of the milk, transitional stools, erythema toxicum, Mongolian spots, vaginal discharge and the bleeding, breast engorgement, neonatal jaundice, cradle cap, Napi rash, and finally cold, cough and sneeze are some of the minor disorders found in the newborn.